All right, guys, Dr. Schuyler here, and I'm here with Dr. Little. He owns the golf clinic in Colorado Springs, and he's going to take me through an assessment because it's hard to do on myself, some of these activities, as well as he has a few extra tools that we're going to use as we continue down this challenge. So we're going to go through this as though I'm a brand new patient and he has no idea who I am to get a good assessment for you guys to follow along in this journey. So with that.
Yeah, hey guys, like I said, I'm Dr. Little. This is my clinic, the golf clinic here in Colorado Springs, and I'm a Titleist Medical Level 3 provider. And so what I do when people come to see me is I establish a body swing connection with them, and the first step of that is what every TPI level 1 member, whether you're fitness or medical or a coach, should be doing is the TPI screen. And it's all done on your phone. You get those results really quickly. I do those for free for anybody who wants to come into my office and schedule time to do it. It takes about 15 minutes. So it's a great insight into the world of golf performance, and it shows us as medical providers just what we have in front of us, what you're capable of doing. It's a movement screen. There's 15 motions involved in it, and based off of what that spits out, I'll grade it: red, yellow, green. Green's pass, yellow kind of dicey, red you didn't reach normal limits or there was pain or something like that in the motion that I asked you to do. And so then what that tells me is what I need to go look at in my SFMA or Selected Functional Movement Assessment, more of like a medical physical exam. So now I need to understand why. So say Schuyler gets through this exam and he can't do a toe touch without bending both of his legs, and maybe one side is tighter than the other side. Well, still need to understand why. Is it hip flexion? Is it spine flexion? Is it a tissue issue? Is it a joint issue? And that's where the medical expertise really comes into play for the golfers. And so after we complete that, the next step in the assessment is to go over to the simulator where we hook them up to some of the technology Schuyler was talking about called the K-Vest, where that is a 3D biometric scanning tool, and it measures in rotational velocity, and it basically spits out a bunch of data. It's an MRI of the golf swing. If we're talking about the how, what, and why of the golf swing, everything I just talked about is the what. It's what you're doing, and that's what we're going to do. We're going to discover today with Schuyler.
Yep. So let's just start. Ask me the typical questions you'd ask your golfers coming in, and then we'll get rolling with the golf screen.
Awesome. Yeah. So typically Schuyler would have completed some, arbitrary paperwork, health background, stuff like that. But I always just end with, and I stole this from Dr. Greg Rose, founder of TPI, but it's an awesome conversation piece. And using the tools that we have here and the team that I build, like people just like Schuyler, fitness professionals, PTs, and golf coaches, we can usually make this happen. So I always say, Schuyler, we're walking on a beach together, and in the sand you see a shiny object, you pick it up, it's a lamp, you rub the lamp, it's a genie, it's me, I'm the golf genie, and you have 3 wishes about your golf game. What are those 3 wishes?
Top one would be to be a plus handicap golfer, so that'd be an easy one. If we could,
super easy.
Yeah. If we could magically wave it, wouldn't it be to drive every green and make every single putt?
Okay, so
that's impossible,
great.
Right, guys?
Those are
perfect.
Well, let's talk about what kind of goes into those things. So, what would you say? If you had to tell me, what do you struggle with the most on the golf course?
Consistency.
And what? Ball striking, distance control.
Distance control, and accuracy.
Okay.
I've developed more speed over the last year, so with more speed comes more responsibility. It actually, it does. It creates a bigger dispersion pattern when you do have misses because your misses are bigger, right?
Yeah.
So if we can tighten that up a little bit. Same thing with the irons, hitting into greens. Even though I have shorter irons and wedges into greens now, it's distance control, so proximity is better. Because that way, as proximity improves, more putts will sink. So.
Okay, so let's get those into 3 solid wishes then. So I would say then your number 1 would be, and you had 2 parts of consistency. You had direction and distance control. So we'll split that into number 1 and number 2. Which one is number 1?
Let's do direction.
Direction. Okay, so it's the dispersion, right? Dispersion package, and then we want distance control second.
Yep.
And then third would be.
I'd say, the purpose of this whole series is for you guys to follow along with this fun journey of distance, right?
Right.
So let's throw distance in there because more distance equates to.
He's always trying to hit it further than me. So.
The swings fast, but I'm more accurate.
Way more accurate. so much more accurate. We should just morph, and then we would play some good golf. So yeah, that's great. So we have dispersion, we have distance control, and then we decided on
Distance. We'll keep that
distance.
on.
Yeah, distance. Okay, great. So those are our 3 wishes. And so by the end of this little exam and screening, we're going to find out how we can best make those wishes come true.
Awesome. All right, guys, let's take a look at it, and we'll voice over the next part.
Cool. Starting the level 1 TPI screen, it's all done on the phone. I take the notes on the phone. I can email him the results immediately after they're done. So the first thing we establish is what we call the 5-iron posture. So Skylar, address an imaginary ball. You're holding your 5-iron, and then I'm going to just examine his posture. I'm looking for spine angles. I'm looking for hip hinge, any kind of irregularities in the posture of his setup. So now simply just cross your arms over your chest. That's the 5-iron posture, okay? So now I'm going to ask him to perform a couple tests in the 5-iron posture. So I want to see pelvic tilt now. I want to see in the 5-iron posture, can we fully arch our back? Can we bring it forward? And I'm shaking and baking today. Good.
A little shake and bake.
Any pain with that? But yeah, totally doable. And we'll get that out in the off season. That's when mine always gets off. So as soon as we hit the gym. All right, here we go. No problem there. Next one, we're going to see, can he stabilize his lower body while independently moving and rotating his upper body? Very good. Okay. Next is the opposite. We want to see, can he stabilize his upper body while independently rotating his lower body? Very good. Check. Now he's going to take that golf club, full extension over his head. We're going to go into an overhead deep squat. Feet are shoulder width apart. There's no toe flare in this squat. It has to be standardized. And then he's going to squat as low as he can to the ground. Woo! Woo!
Uh-oh.
Let's do another one.
I think your floor's crooked.
Okay, good. All right. All right, so I want to check one thing now without the golf club. Arms down, deep squat. Because I didn't like how far Skylar kind of came forward with his arms in extension, it's already telling me some things that we might need to look at later. I want to see with his arms down if he can keep his posture a little more centered over his... There we go. Can you put your both your palms in between your heels?
Yeah.
Right. I want to see this.
I know. I can't ape sit, man.
Okay, all right.
There it goes.
Yeah, and you're falling backwards.
Yeah, I'm
every
falling
time.
backwards,
Okay.
yep.
And that's okay. We want to be as super picky about these kind of things as we can, because Skylar's a very good golfer, and so I want to be hypercritical of these things because we want to find any area of improvement that we can during this process. So the first thing I'm going to look
And
at.
don't
now,
warm up before you show up to do these.
No, that's cheating. We want to do these cold turkey. So we're going to look at, now because of that, I do want to look at dorsiflexion really fast, so his ankles, to see if that's stopping him from really getting down. I don't think it is, but we're going to test it just to be sure. So a good way to do that is you use your fingers to approximate about 4 inches. Just I use my span of my 4 fingers here. And then I say, Skylar, keeping your heel on the ground, try to touch that knee to that golf club. That's tough. So we have some limited dorsiflexion. We're going to check his other leg. His 4 fingers. A little better, but limited dorsiflexion, right? So that's one thing that I'm able to mark down on my app. And when we go do my SFMA, we're going to look at that a little closer. Okay. All right, toe touch. Feet together. Toe touch. Great. So where do you feel most of that stretching happening? Do you feel hamstrings? Do you feel back?
Nowhere.
Nowhere? So, that's good. Spine flexion is great. Ankle flexion, not so much. All right, so now we're going to look at external rotation or 90-90 here. So I like to start this one standing tall, and I want to see with both arms how far he can externally rotate his arms back. Okay, now I want to see, can he keep at least that same angle? So go back to full external rotation. Can he keep that same angle or greater and get into his 5-iron posture? Yes, he can. I'm going to give him a yellow just because we're talking about this out loud, because I did not see that he could get past his spine angle on those. He was pretty equal to his spine angle. The good thing is that he maintained that in the same posture on the way down. What we see a lot of times is as we go here and we start getting into this posture, that people can't keep their arms in extension, or they start to really arch their lower back. Things like that that I'm looking for that could cue me into problems in the body that might show up later in his golf swing. Spine angle, same or greater. Spine angle, same or greater. Okay, we're gonna do single leg balance test now. So start on your right leg. What? Yeah,
Right leg.
okay, right leg, there you go, right leg. And get the knee all the way up in front like this. This is one of Skylar's, I think one of Skylar's superpowers is his stability in his golf swing is phenomenal. Yeah, no problem. Okay, so I'm gonna challenge you to do at least 5-10 seconds eyes closed on the same leg now. Okay, so areas of improvement. That right there, and especially how rock solid he was when he was stable, is better than 95% of the population that I see. So I have never had, ever, even some really high level golfers, ever had anybody pass a full 10 to 15 seconds eyes closed. Single leg, doing it correctly, not cheating.
You want to try a 15-second one?
You want to try? You'll see. He's up for the challenge.
All right, hold on.
That's pretty great. Okay, it's probably tied for the best I've ever seen.
Now I'm just showing off.
Let's do the other
that's
leg.
My weak hip right now.
That's really good. Let's do the left leg.
I did chase after the dog.
How's the puppy doing?
She's alright. She's in my chain.
Close your eyes. Excellent. Yeah, for sure giving him. I'm getting like one of the only greens I ever give out on that test. So, all right. So we're going to, let's do that one. We'll do these ones that are quick real fast. So let's go ahead and face the camera here because all I'm looking at is mouth closed. I want to see full cervical rotation. So I want to see you turn your head to the right. And then from here, without lifting your shoulder up, try to touch that chin to the collarbone. Excellent. Okay, now turn left. And we're just looking for rotation past mid-clavicle line. And then he doesn't really need to shrug. That was really good. So it's like he sees a good chiropractor or something. So now we're going to do some wrist angle stuff. So he's going to hold this club out in front of you here, and I'm going to look at internal and external rotation of the forearm and shoulder. Ooh.
Yeah.
Any pain on that external rotation?
No, that elbow's been jacked up lately though.
Okay.
So
pretty
we'll
restricted.
have to take a look at that.
We are going to take a look at that. But pretty similar, both sides.
Yeah.
Could just be you. So we'll take a look and see what's going on there.
I may have small arms, but they're tight.
Sex ball.
I should keep that in. Just like make it really quiet. It'll be like the Disney movies.
Oh man. Oh yeah, I like the little Indian
Yeah.
suit one. That's too funny. All right, and then that was good.
YouTube will flag this as this is no longer
Flag
appropriate.
it up. Do it. Okay, now we're gonna look at different wrist hinge angles. I bring the 6 iron again because it's a 60 degree lie angle, and that's the pass or fail. So we'll go radial deviation first, and all I want you to do is match. Yep, perfect, good. And then match this. Great, ulnar deviation, great. And then we're gonna go wrist flexion, perfect. Wrist extension. That's the opposite of what I just said. That's what I just said. I said it wrong.
Oh, did you?
Wrist,
Okay.
wrist flexion.
Yeah.
Yep, perfect. And wrist extension. Great. We'll look at both arms there. And we'll go.
It's late in the day, guys.
We'll go flexion. Good. We'll go extension. Okay, and then sideways, radial. And ulnar. Over his shoulders, and he's gonna rotate both directions. Good. And a little limited there, right? On his backswing again, on that coming to that left side rotation, I see a little less than 45 degrees of rotation there, so that's an area of a potential improvement. We'll look at that closer. All right, now we've just got, I believe, to do the lat test and the single leg bridge test. Okay, so I'm gonna have Skylar get to where his whole spine, his lumbar spine and thoracic spine are as flat against the wall as he can possibly be. He's gonna face his palms in towards his face, his thumbs are gonna be sticking out, and he's going to extend and abduct both arms towards the wall and try to touch his thumbs against the wall. Good, and then I look here and I say, yeah, that's tight. I'm looking for space between the wall on his lumbar spine here that can indicate some tight posterior chain muscles, lat, stuff like that, again, that I would check out, but he passed that one really well. So let's look at last one on your back. It's a little single leg glute bridge test for some stability in the lower body. Again, another lower body stability test. Yep, he's gonna get up on one leg, arms are up in that position. I'm just looking for cramping. Obviously, if he can even complete the motion and get up, and if he can hold it for 15 seconds, which I'm confident that he can, switch sides. And you'll be able to talk to a player, like if you see them struggling, you can ask them, do you think that you can do this for 15 seconds? Or are you cramping? Usually the cramping is pretty obvious. So, all right, good job. All right, and that is it for the level 1 screen. We're gonna put it through and look at his golf fitness handicap, and it says that Skylar's golf fitness handicap is a 14.
That's a lot compared to my 1.1.
He's a much better golfer than his golf fitness handicap, and you know that's very common for these super high level golfers to have these issues that they're overcoming on the golf course and still performing at that high level. And so this just goes to show you that there's always room for improvement. It's one of the most beautiful things about the game of golf, chasing perfection. And I did tell him a quick anecdote about how on the higher handicap players, 20 and up, usually their fitness handicap is pretty close to their regular handicap. And so that's kind of a funny notation to make. So we're done with this thing. We're gonna head over now and we're gonna look at the medical side of what's going on and try to discover. So if we talk about his results, right, we had a problem in overhead deep squat, specifically in that ankle flexion. I'm gonna look at a couple other parts of his body to make sure that everything is okay and really figure out why he's struggling with the overhead deep squat. Trunk rotation, we had a difference in side to side there, so I'm gonna look closely at that. Forearm rotation, supination was restricted on both sides. He had some slight issues on 90-90 and lower quarter rotation. So we're gonna check out all of these now in the medical exam. So now we're over here in my treatment area, and we're going to look at Skylar from a more medical lens. We're going to do what's called the SFMA movement screen on him. It's a selected functional movement assessment developed by the guys at Functional Movement Systems. And so what we're going to do is really ask Skylar to move in a couple extra ways that we didn't have him do at the TPI screen, and look at the anatomy that's involved in some of these motions in that screen and the screen I'm going to do, and figure out exactly now what's going on. Is it a muscle issue? Is it a joint issue? Is it a neurological issue? Is it a stability issue, right? All those questions that we're going to answer right now with this test. So first thing is I'm actually going to have Skylar stand again. You're going to stand, and we can just do everything, and you can stand in that position right there. So you can face the camera if you want. I want to see full range of motion with the cervical spine now, so I want to see chin to chest. We already saw rotation. Okay, and now go full extension for me. Okay. Now I want to see, so I'm looking for things like uniform spine curve, excessive motor control, so is he really struggling to perform that motion that I'm asking him to do? Or obviously, is he getting within normal ranges of motion? And then the overarching thing, is there any pain in any of these motions? Okay, so now we're going to do full body extension. Arms abducted, internal rotation. Now I want you to extend back into an arched back position as far as you can. Wonderful. Again, I'm looking for the ASIS to reach above the toes. I'm looking for the shoulder blades of scapula to approximate behind his heels. He reached all of those great. The only thing I'm going to look at, which I saw in the extension of both sides, is a little bit of non-uniform spine curve of his upper back, which we know is a problem. The upper back and the lower cervical spine seem to be moving together, and we want to see if we can separate some of those up a little bit. Okay, next I'm going to have you do, so we did that on the screen. We're going to do some specific shoulder motions just to check them. I'm going to see a pattern ones. I want medial rotation and extension of the shoulder. So we're going to go arm out and touch the opposite side of your shoulder blade there. So I'm looking behind him. If you turn back around, can we touch that bottom corner of the shoulder blade? Good. And then again, we're always looking at the smoothness of these motions. And then now the left arm. Wonderful, really good. So now we're going to do the pattern 2, which is, can you reach above and touch the top of the opposite shoulder blade? No problem. Same thing over here. Any issues with those?
Nope.
Nope. Okay, good. No any tightness?
No, a little bit in the lats.
A little bit in the
That's
lats.
from working on.
Yeah.
Yeah, so he did pretty good on those, so we're not really super worried about those. So now we're gonna look at what other movements do we. So the last one, I'm gonna look at full body rotation. So actually face away from me, Skylar, feet down, get together. I want you to twist your whole body to try to face me. Good, okay? And again, when he's coming this way now, I'm noticing the pelvis isn't rotating as far when he's going to his right, which is that left, that left hip, right? And so we're finding some similarities between that quick medical screen and the TPI level 1 screen that we did on him. So now that I have this data, I'm gonna look into each one of these segments and figure out the exact anatomy involved in what may or may not be causing some of these issues. So we're gonna start with cervical range of motion. And so I'm actually gonna have you lay on your back, Skylar, with your head this way. Hanging off the table. Keep coming, keep coming, keep coming, keep coming. A little more, right there. And all I want to see is with gravity, passive range of motion, what his spine curve looks like in extension. And that's so much better without active muscle activation, right? No pain with that? Okay, good. Okay, go ahead and sit up. That's the only one I needed to check because you passed everything else on that one. So I want to look now at, he did a great job touching his toes. When we did the flexion, it's okay. And so, our first take of the TPI level screen was pure gold, and we lost it. So, anyways, but that way, put your feet down towards me. It's so bright in my office. Sit up, do a long sit for me. I want to see, can you touch your toes from this? So no problem again. This, again, is going to help me differentiate between spine flexion and hip flexion. By taking hip flexion out of the toe touch here, I'm looking at how good does the spine flex, and that was obviously pretty good. There was not much difference there. And so we're leaning a lot towards now, we've got some problems with the ankles. I'm going to demonstrate, I'm going to look at full ankle range of motion now, because that's where my tester leads. So for this one, we're looking at, I want to see, without wagging your knees back and forth like this, can you keep your knees stable and can you invert both your ankles? That's tough.
Yeah.
Yep. Can we evert our ankles? A little easier.
Yeah.
Good, knees are stable there. Yeah. So inversion, both sides, we had some issues there. So we have, here's a little pearl for you. When I'm looking to differentiate between a joint problem or a tissue problem, I'm going to look at a joint. If he has a problem in range of motion, we've seen two different planes of motion now that Skylar has problems with his ankle. He has problems with flexion in the deep squat, and he has problems with inversion, right? So once we start getting past a one plane of motion, we start to think that could be a joint, not just a tissue issue, if you will. So tissue tends to be a one plane range of motion problem. When we start getting to multiple planes, we're going to look at the joint. So now I'm going to have Skylar lay back on his back again, and I'm going to look passively at some of the ankle motions. So. No restriction at all inverting passively, which is really good. Yeah, passive inversion. This one is stiff. So passive inversion on his trail leg, which is the one he has an issue with in the swing, right? So we have some passive restriction here, and this ankle overall does not want to flex on this side either. So overall, we have a joint restriction. We're going to be developing a mobility treatment program for this ankle for sure, and we'll talk about that later. Okay, so now let's look at hip flexion just to please the people. Keep your feet flat for me. Keep this leg down, raise that leg up. Great. Okay, now relax. Just a hamstring stretch.
Not quite yet.
But that's okay.
Yeah, that's fine. Yeah.
Okay, so you see how I get him to 90 degrees there, no pain, passive range of motion, that's good. Let's try active this side again. A little better on this side. So we're seeing some problems on the left side pop up, right? And that's normal. Let's see if proper core bracing will help him get that last little bit of on his own here. So palms here, push down, engage your core into me, push hard. There you go. Now raise this leg. Fly up, kick me in the face, right? Okay, so again, I'm looking then, that is a test for a stability motor control issue. He is not utilizing his deep hip flexor, so his psoas part of his hip flexor on that left as well, and that can be a neuromuscular issue, or it can just be a weakness issue. So we're gonna look a little closer at that later, but that's definitely gonna be a part of the protocol that we do when we're developing the body swing connection. We're going to see now, after I complete all these examinations, we're almost done because he did really well on his screen. We're going to see if any of these other issues show up on his golf swing. And so after we use my technology to look at that, then we establish what Titleist calls, what we call the body swing connection. And so you're gonna have exact problems that are showing up in your golf swing that we found in the physical, giving us an objective plan to move forward on how to attack those issues and fix both at the same time, your body and your swing. So last thing I need to look at, shoulder rotation. We gotta look at thoracic spine rotation, because I think lumbar is probably fine, and we're gonna look at hip rotation. So we have a couple things to look at. Let's go ahead and flip on your belly for me. So we're gonna go, rest of the test are pretty much gonna be on his belly. Now his left leg seemed to be the one that was having trouble. So we'll start with the right leg, and we're just gonna look at passive external rotation, which is great. And internal rotation, that's pretty good. That's normal, no tightness there?
No.
Good. Okay, and we'll look at the left leg. Say the left leg goes in, and that is great. Internal rotation, no problem with that, right?
Yep.
And then external rotation, we
A little tight.
we get a little tight there, right? That's not going down without me. Is there pain when I go
No.
down just to stretch?
No.
Where do you feel that stretch?
It's actually a little bit
You feel like TFL like right in the front
Yep.
side. Side there, great. I'm gonna look at hip extension now on him just because we're looking at full range of motion. So keeping your ASIS to the table, raise this leg straight up off the table. Drop. Look at that. That's crazy. You have a ton of hip extension. Okay, this way. Drop. Yeah, okay. So in both those instances, you could see where passively I could get a lot more range of motion out of him. And this is a very common finding that we find across all of our golfers, pros, amateurs. We have a pattern in humans for some reason or another due to injury or the way that we sit too much, and it probably has something to do with something that's called lower cross syndrome. But what happens is whenever I say extend your hip, we, for whatever reason, want to use our back to do that. And that should not happen, right? So this is a big problem in the general population, but it can also affect your golf swing in negative ways. If every time our hip wants to go into extension, our lower back also wants to go into extension, that is not ideal. So we're going to look closely at that. So lastly, on this plane, let's look a little bit at shoulder mobility. So I'm going to hold him at 90 degrees here, and I want to see again go into external rotation as much as you can. Okay, now drop the arm and relax there. If I brace his arm correctly, I can't get much more. That's tight, right?
Mm-hmm.
Yep. So now we just need to see if the arc is complete. So I want to see internal rotation. How good is internal rotation? That's also kind of limited. So we should see at least 180 or more degrees with that, and he's just barely not getting there. And that is tight as well. So we have shoulder tightness on both sides, limited range of motion, passive and actively. So we're going to look, and if it's unilateral, I'm going to look closer at that. If it's bilateral, which it might be based off the other test, we're going to look really closely at his thoracic spine because we already had some indicators that thoracic spine might be a problem, but thoracic spine will always trump shoulder issues, even if there's pain in the shoulder, because the shoulders attach themselves to the thoracic spine, basically all soft tissue. There's hardly even a joint in the shoulder. It's just slapped onto the body with muscles. And so we find in treatment, in the clinic, that by treating most issues in the thoracic spine, a lot of times you can fix a lot of issues in their shoulder. So let's continue the exam over here. Internally rotate there, and then relax. Is that a good stretch though?
Yeah, to the anterior side.
Yeah. Okay. Not super painful?
No.
Ooh, that was worse.
Yeah.
Okay, relax. Yeah, cramping, huh?
Yeah.
Yep. Where'd you cramp? Back.
Terry's lat.
Okay. Yep. Lat.
Yeah.
Okay. Now drop your chest. I'm just gonna stretch. That's it. Yeah. Just tight.
Yeah.
Because that's going. As soon as you relax and you actually let your scapula move, it's going. Okay. So now we're gonna look at the thoracic spine and we're gonna check to see if that's an issue. Go ahead and get on your hands and knees for me, Skylar. So now I'm gonna ask him to rock back on his heels, and we're basically locking the lumbar spine out of this exam. He's gonna get both forearms underneath him like this. We'll start with this side facing you guys. Put that left hand behind your back like that, and now I wanna see him rotate his chest up as high as he can. That's pretty good. And now relax. That's perfect right there, right? So a little room for improvement there. When active doesn't mean passive, we can always train that motion back. If you have it passively, correct training and treatment can get there actively. About the same, actually, both sides. That's just tighter overall, though. Yep. So little limited passive on that, and we saw that in his upper quarter rotation in the TPI level 1 screen. So let's look closely at the lumbar spine now. So, yep, flatten out for me, perfect, and then get those forearms tucked back under you. So the same test that we were just doing. Yep. Same test, yeah, just like that. Let's do this side first. Arm goes back here. Now we're isolating the lower back here. Yep. And so I'll kind of move here. That is no problem. That's so good. That's perfect. No problem there with his lumbar spine. Yes, he has got no issues at all. Full range of motion with the lumbar spine. So we know that from our exam, we have a thoracic rotation and extension mobility disorder on both sides. A little bit more of an SC, stability motor control, going to the left because the passive was so much greater than the active on that one. So that can be trained in. We're going to really have to look closely on what's catching on this right side and deliver a good mobility program to see what we can get on that backswing. So that is all that we need to look at for Skylar as far as the body goes. I'll finish my notes up. So since we did see some shoulder issues pop up on both shoulders, one side. Do you have a history of shoulder injuries? Do you want to no, tightness overall?
Just tightness
okay,
overall.
So
it's more neck.
Are you having any pain in your shoulders?
No.
Just if no sharp pain with workouts, something like that. Great. So that's really good. It, to me, probably just indicates a lot of muscle tension, tightness, like we were talking about. In my opinion, especially on external rotation, we're looking at the teres minor, teres major muscles. We're looking at lat, all those external rotators of the arm, and so that's kind of where we're having issues. The good thing is his lower lats are pretty good because he can still move his lumbar spine, and he's not having trouble with the lat test when he raises his arms above his head at all. His lower back's not involved with that, which is a very common theme. So pretty interesting case. You'll find everybody's different. You'll find a lot of people, when you start getting to higher level golfers and people that are fit, they oftentimes are super unique because they just have different problems than the average population. The average population, you're going to find a lot of the same issues, like over and over again in those kind of folks. So, all right, so let's go ahead and let's get hooked up to the K-Vest, and we're going to go analyze his golf swing now. All right, Skylar. So now we've got the sensors all in place. What we're going to do is calibrate him because obviously, if you guys can see, I know the glare is terrible in my office.
I look like this on the screen.
It's pretty bad. So go ahead and address the golf ball for me. Good, and now just stand straight up, arms down by your side, chest out. Calibrated, set your address again. And swing away. Wonderful. Perfect. Okay, if you guys can see the screen again, really difficult. We'll show you some graphics of this later when we pull them up as we go through this journey. But basically on here, on the measure screen, all you see is the avatar of Skylar, but you see these numbers over here, and they all have Tour Pro ranges of peak speed during the golf swing. And so we're looking at tempo, timing, backswing, downswing. He's green, everything except for a little pelvis. And this has been Skylar's problem. He's a little too stable in his pelvis, right? When it comes to
mentally unstable, publicly unstable.
Mentally unstable, pelvically stable. Yeah. And so we can see some of these things, and we're going to let him take 3, 4, 5 swings. The K-Vest doesn't really care what the flight of the golf ball is, what the contact's like. It's only looking at his body. Those are 2 really good swings back to back.
Yeah.
Great, and so we're going to notice, he'll take 2, 3 more here, and so go ahead and just swing, Skylar. You're going to notice the numbers aren't going to change drastically. His swing is his swing right now. Even if he hits one better, like that was a little toey.
Look how consistent that is.
Almost identical, yep. A little heavy.
No, that was perfect.
It was good?
It was great.
That was great.
It's great.
So pretty consistent. Wait, one more.
That was Toby. Look, numbers are consistent.
Yeah,
All right,
okay.
sorry for the glare, guys. We got some sun coming in off of Pikes Peak, but Jacob's going to explain what we found with that K-Vest.
As you guys can see, there's some graphs up here on the board. So this is just such a cool piece of technology. Titleist has been working with 3D biometric tracking
for like the last 15 years now. And when they first started doing it, they put the top 100 golfers in the world on measuring tools like this, and they discovered something truly fascinating about the golf swing. They discovered that it didn't visually matter what the style or visually at all, what that golfer's swing looked like. Every single one of the top 100 golfers in the world sequenced their body the same order through the golf swing. And so now we have what's called the kinematic sequence, which is the efficient example is up here. This is an average of the Tour pros that do it well. And then we have Skylar's over here, right? And so we see the way that the golf swing should work is like a flow of energy from the ground up through your body, and it should go in transition. Pelvis starts to move first, reaches its peak speed first, slows down, transfers that energy to the thorax, which then starts to move, and it reaches its peak speed second, transfers the energy to the lead arm, to the hand, to the club, etc., all the way through the body into that club head for maximum efficiency and no wasted energy in the golf swing. And so the best golfers in the world all have this sequence. So very, very, very minimal exceptions. But we can see right here that Skylar does it wonderfully, right? 1, 2, 3, 4. And that is the correct order that we want that in: pelvis, thorax, lead arm, club. If we look closely at his graph, though, we can kind of see how sometimes it's close. It's not. There's not as much separation as we would like. Okay, and that can be a little bit represented if we look at the graph in his backswing. So we look at his backswing, and if you look at the efficient example, you can see these nice intervals between these lines, pretty evenly spaced between all of the lines. This is a good indicator on where he's generating the power in his swing from. And if there's any big outliers, it can be a big, so say we've got a big outlier where all these lines are jumbled up, and what I see a ton of is the gold. The arms are there's a big gap between the arms. That can lead to shoulder injuries, wrist injuries, because the player is using their arms to generate most of the power. Skylar, though, has no problem between the pelvis and the arms. He's just having trouble. He's losing some energy between his thorax and his lead arm, right? And so we can see these lines overlapping here. I'm not really worried about a risk of injury. Oh, it just shows that. Okay, thanks. I scared it. Walked over there. And so it just shows that we're not as efficient as we can be in this transition, and we don't have as much separation here. But the order is amazing. I spend so much time teaching people and asking my tour pros to help people with sequencing, because this is super important in the golf swing. This is what leads to effortless power in the golf swing. Peak speed should match the transition sequence like I explained earlier. Your pelvis should reach peak speed first, thorax second, arm, club, right? And so we should see this incremental increase as we transfer the energy. It's almost like a slingshot, and you just build more and more speed. Obviously, our club head should be the fastest moving thing. And so we're going to look. Go ahead.
Well, yeah. So we'll do a cumulative video where we wrap everything that we did today together. We're going to finish with some swing speed, ball speed, and carry distance. But Jacob, wouldn't you agree that what we're finding deficits in my thoracic spine might be leading to some of what's going on here?
Exactly. So we see, what do we see? In Skylar's exam, we saw some problems with, and what does this measure? Rotational velocity. And we saw problems with rotation of the thoracic spine and rotation of the shoulders, right? And so we see here how these are stacked right on top of each other, no separation. And in the backswing, he's having trouble even just separating the power between the two. And so that is where we're seeing our biggest overlap currently between the thoracic extension and rotation, body swing connection, the external, limited external rotation of both arms, and probably to some extent even the supination. And so we look at these, we make the body swing connection, and then we look at all those body parts that are involved, and then we talk about like I said, an objective fitness, mobility, and treatment plan to fix all these issues. So.
And the reason I asked him that question is because I knew the answer, but also because it goes to show that when one of us takes you through an exam, right, there's a purpose behind that. It's to help your golf coach get you to that next level and say, hey, you know what, they're not moving in X, Y, Z, or they're not stable here, because if we utilize that material to help you get better at moving properly or build that strength, build that power, it's going to help your golf coach develop your game into a whole nother round.
Yep.
So that's the importance of communication between us as medical providers and fitness experts, as well as your golf coach.
Yep. Yeah, great. So I'll add one little tidbit in there. Scotty Scheffler, I use this all the time, said it in an interview, and he describes what our job is better than anybody. He said that most amateur golfers can't play the kind of golf that they desire to play, not because they lack any kind of hand-eye coordination, it's because their bodies can't physically do what's required to hit a consistent, efficient golf swing. And that's our job, is to make your body as capable as it can be to make the best golf swing that you can make.